Alright, so we want to actually look at the perineum, but we are looking at the perineum as a bad guy now. Alright, so we're looking at the perineum as an obstacle to the fetus. Of course, as the baby is trying to maneuver their way out, okay, through the birth canal, the baby come across a barrier, okay, something that is trying to kind of like stop the baby from coming out, and that's the perineum. Okay, so the perineum is somehow a barrier, okay, to the baby coming out. Okay, so perineum, of course, is the area between vaginal opening and the anus, so it's a natural obstacle to childbirth. Okay, so without the perineum, everything should be going on fine and fun, but because the perineum is there, the baby has to struggle their way out. Okay, so perineum is made up of muscles, connective tissue, skin. So you should know that this is not the pelvis, right? Perineum is the outside, while the pelvis is the bony part inside. Okay, so it must stretch significantly so that the baby's head can be able to come through. So if the perineum is tight or rigid, it can slow down or even obstruct the whole process of delivery. Okay, so in some cases, if there's a whole lot of resistance to it, they can have all those perineal tears. And sometimes they have to do episiotomy, where they have to like cut to increase the opening, you know. Then it can also lead to a prolonged second stage of labor. All right, then the baby can struggle to come out for a very long time, that the baby can become distressed. All right, so this is the perineum, the outside, okay, the connective tissue, the muscles, and the rest. So how the fetus navigate the perineum? So as the baby head crowns, it exerts a lot of pressure on the perineum, so it makes it to bulge and further thin out. Okay, so the perineum must yield gradually to avoid any trauma. Okay, so proper positioning, controlled pushing, perineal support by the birth attendants can help to kind of like minimize any injuries that should come up, you know. So factors that influence perineal resistance is the age of the mother, okay, then also massage, warm compress, delivery position. Okay, so the position that the mother is at too is also very important. Okay, so the perineum is actually an obstacle to the fetus indirectly.